the last 2 years was not extremely easy. We managed. We have been running through our activities mostly online, and we have been able to implement the project more or less as planned. And I was really happy about that. And the last big challenge for us was to find a set of mirror regions that would be interested in learning and replicating what we are developing. And we had a very high interest and really good applications, and I'm really happy to welcome 4 regions in the CHERRIES family, so to say. I just want to give you a brief overview about what CHERRIES is about. You can say when we develop a model that is demand-oriented, building an open and responsible innovation. And this is also where the project is rooted in. It's about responsible research and innovation, RRI, as a way of doing science with and for society. That was the Horizon 2020 way of phrasing this. It's rooted in this new mission and challenge oriented, where the public sector, public agencies are gaining an importance again in shaping directionality of innovation after treating innovation as a mere means of economic competitiveness over the last 20 to 30 years. So this is a little bit of a shift in paradigms again. And we are focusing on the regional level because we want to address local challenges and build and co-create with regional stakeholder ecosystems. So the project is aiming at creating more open, inclusive, self-sustaining research and innovation ecosystems, create some societal and economic scientific impacts, democratic impacts. The environmental ones are not our main focus, but it could have been a possibility also with medical innovations. And to develop this new demand-oriented R&I working method and transform organizations and ecosystems that are involved. Next slide, please. What are the main challenges in healthcare? So like, I think most of you, I think only the region of Burgos is not focusing on healthcare. Everybody else is focusing on healthcare. We see a lot of aging societies, people have chronic diseases, have comorbidities. This is creating pressures on the healthcare system. And the healthcare system is also basically focusing on increasing the quality, being more efficient with the resources that they have, while there is more and more pressure on it. So innovation often is seen as a way of dealing with this double pressure between increasing challenges from patient side, demand side, and from not increasing resources. But we know that healthcare innovation often are not taken up, even though there is evidence that they actually do work, which has to do a lot of the logics of the sector, so to say. And we think with demand-oriented approaches, co-creation and ROI approaches, we could mitigate these issues and develop innovations that are actually have a higher chance of being adopted later on. Next slide, please. This is an overview of our project, just to give you a brief idea where we are, what we have been doing. We have 3 strands. So here in the middle, you see this, 3 strands and 3 phases. We're working on policy with stakeholders and with innovation. We started with mapping what's going on, developing our model, and we have been implementing our model. And now we are coming in a phase where we say, okay, we want to make sustainable what we're achieving, and developing this community and sharing our experiences as part of the sustainability work. Next slide, please. The model, this is illustration of it. Basically, what we're doing is starting from a need identification based on stakeholder bottom-up engagement, collecting these needs, develop a challenge, have an open innovation challenge where we are selecting potential solution providers, and then collecting the ideas from solution providers on how to tackle this challenge. And from this challenge, from the solution providers, we selected one, and this solution provider then went to a co-creation process with people who identified the need in the first place. So the flow was really like bottom-up, identifying a need, helping the help of us. We developed this challenge, open innovation approach to collect ideas, selecting an idea, co-creation, and that's where we are right now in the regions. Next slide, please. Just a brief overview about what are the needs that we identified. You see, we have three very different things: breaking and preventing involuntary loneliness in elderly in Örebro, the provision of medical services for Cypriotic citizens living in rural and remote areas was a challenge in Cyprus, and the early detection of the progression of multiple sclerosis was the challenge in Murcia. Next slide, please. And here you see the ideas that were coming out of this process. I don't want to go into much detail because the other presenters will talk about it, but just like even a brief idea how the needs and the solutions are connected here, and what we were able to do. Next slide, please. Yeah, and that's it from my side. I don't know if you have any immediate questions or if we hand over to the regional presentations.
Thank you very much, Stefan. I think you have given a really nice framework on why we are working on CHERRIES, which is the background information that we have before working on the CHERRIES project. And I think it would be better if we have the presentation now from each of the CHERRIES regions, just explaining their profile and the areas where they are working, and then we can open a question session.
Of course.
Okay. So now I give the floor to Cyprus. This is one of the three regions that it's working on CHERRIES pilots. So the floor is yours, Moises.
So good morning, everyone from Cyprus. I'm Moises and I represent the Cyprus Research and Innovation Center. We are the EPN member in Cyprus and also the facilitator of the regional pilot of Cyprus through CHERRIES. Next slide. The name of our pilot in Cyprus is provision of medical services to the Cypriot citizens that live in rural and remote areas. It's quite a long as a title, but it was a big problem that we managed to identify through the demand-driven approach of CHERRIES. So we're very happy about that. Next slide. Some useful stats about the region and why this matters to us. We are an island in the Eastern Mediterranean, a country with a population of less than 1 million, but we have 6 provinces, so they are densely populated. But the truth is 40% of the population is living in rural and remote areas. Some also very important statistics is that Cyprus has spent less of the European average in healthcare for the last years, and we're trying to change that on the island. So you can see that although the major healthcare, let's say, healthcare providers in Cyprus are situated in the city centers, there is a majority of the population living outside the city centers. So that was a problem. Next slide. We have 2 targets here. We need to provide, since the latest integration of the national health system in Cyprus in 2019, the same healthcare quality and services to the people that live outside the healthcare providers, outside the catchment area. So the major aim here is to provide accessibility and quality of medical services to the communities with no easy access to medical centers and healthcare professionals without them having to travel long distances to access these services. This includes specialized categories of people such as the elderly, chronic patients, people with disabilities, or any other relevant medical conditions. Next slide. Together in this partnership, it's Aradeon Hospital. It's a leading healthcare provider in Cyprus. And part of this pilot is not only for the hospital to provide these quality services to the citizens of the country that are outside the city center, but also to expand the in-house services to these rural and remote areas. Next slide. So that was a typical example of the need. I want to emphasize that through CHERRIES, we had a difficult time to explain what is a demand-driven innovation approach in this situation. And we're very happy that although we have received different needs from the submitters, the common denominator of these needs was the remote access to this type of services. So either you are a chronic patient with a specific disease, or if you need any diagnostic, let's say, treatment or consultancy, medical consultancy, the common denominator, it was not the disease itself or the issue itself, but the remote access to this service. So COVID was a catalyst in this situation, and CHERRIES was lucky, let's say, enough to kick off as soon as this situation outbreak in 2020. So it helped us identify, let's say, and highlight this need. Next slide. So we wanted to turn the previous situation into this e-health solutions. In Cyprus, we have established an e-health policy. We have an e-health commissioner now, and we want to provide people's accessibility to high quality healthcare services. This will also enable not only for other citizens to enjoy the same benefits, but also to operate smoothly through the COVID, let's say, situation that are very hectic on a physical space on hospitals. Next slide. So there is a lot of agility in this particular pilot, because the solution that it's solved can be, it's not specific. We offer the technology, the access, the roadmap to provide services in remote interaction with doctors, assistance to chronic patients that they have any particular disease that needs monitoring or daily measurements, physiotherapy sessions to the aging population, guidance to on-site professionals and care staff, and any other potential solution that fulfills this requirement of remote access to healthcare professionals. Next slide. So Doctors Hello is the pilot that has been chosen to collaborate with us. It's a telemedicine system from Greece that has the ability to combine online individuals, doctors and users with digital telemetry media and diagnostic devices and structured medical information in cooperation with the hospital systems and always in integration with the general health system. Something very important, next slide, in this particular solution is that there is no third party involved. So we are fully compliant with the peer-to-peer and telemetry medical solutions with the GDPR regulations. The system is fully integrated with the hospital systems. There is a hardware device that can be added in a specific region, and the doctor, as well as the professionals, have direct access and communication with the patients, with no third parties involved. Next slide. So the benefits that we see through this pilot for the region is to develop impactful and responsible solutions for the citizens of Cyprus. We also need to replicate this model in the future if it's successful. We want to lead by example, so we need to adopt the whole CHERRIES approach on a regional level. We receive high-end professional support from the leading healthcare providers in Cyprus. Next slide. We are currently in the 5th month of the pilot. The system is currently being set up as we're talking, and we have the first patients and professionals registered on the system, so they can start using it right now. So we're looking forward to showcase and share more results with you in the near future. And thank you for your time and for joining us today.
Mm-hmm. Thank you so much, Moises. As I said, I think it is better if we all present what the three pilot regions are doing, and then we will open the floor for questions. Okay. I think what is interesting from the Cyprus example is how ambitious, let's say, was the challenge that you selected, but how aligned it was with the real needs of Cyprus. So I think it's been an effort just to put everything in place, but now after 5 months, it seems that it is working, and we are able to share our knowledge with you. Okay.
So,
sorry, Moises, go on.
Although it was very hard to adopt the demand-driven innovation approach of Cherries, at the end of the day, it showcased that the demand-driven approach was on spot for us to identify, let's say, the real need of the regional ecosystem.
Yeah, thank you so much. So the next CHERRIES region that is going to present their experience, it is Murcia, based in the southeast Spain. So I leave the floor to Lor Raso. So Lor.
Okay, thank you very much, Mia. Thank you for welcoming us today in this session, and congratulations to the 4 regions that have been selected. We are looking forward to working with you. So yes, my name is Lor Raso. I'm working as a EU project manager in the European Business Innovation Center of Murcia, called CEIM. We are also, in the case of Cyprus, we are also a member of the European Business Network, and we aim at promoting entrepreneurship and innovation by supporting technology-based startup companies. So yeah, next slide, please. Yeah, so Murcia, where is Murcia? Is located in the southeast of Spain. As you see in the map, it's a region of 1.5 million inhabitants, and we are occupying, let's say, 3.2% of the national population. So it's a region with 45 municipalities, and the main sector of activities are agriculture, livestock, and manufacturing industry and construction. So please, next slide. So as you know, Cherries is focused on the healthcare sector. So I'm presenting here the main actor. Here it's collaborating on the project as is called SMS, the Solution Murciana de Salud, is also a partner of Cherries, and is really involved in all the co-creation activities we are doing right now, with 23,000 professionals, 11 hospitals, 85 health centers in the regions, and the regional Murcia healthcare service is also very involved in EU project and innovation. Next slide, please. So, in the case of Murcia, we first have had this call for needs, as in every region, and the need that has been selected is to detect the early progression in multiple sclerosis. So, please can you? Yeah. So first of all, as explained in the methodology of Cherries, we have like 3 stages. And the first one, it was a call for needs. We have received very different, let's say, needs, but the one that was best, let's say, regarding the potential of the need and the challenge that is linked to this, was the multiple sclerosis, as it is really prevalent in Murcia, and in national also point of view. So it's the main cause of neurological disability in young adults, and the patients and neurologists need a faster and more sensitive way to detect this progression. So the idea is to develop and validate a solution, an ICT solution for the collection, analysis, and monitoring of the daily activities of the patient through some devices as a smartwatch, to see if we, thanks to this IT solution, we can see on a period of 5 months if we can detect the progression of the disease. Next slide, please. So, yeah, I will go briefly in this. The needs expressed by the patients are the frequent symptoms, often invisible, that leads to some progression, but they are not really maybe detected by the periodic checkups with the neurologist, because patient can forget to describe some symptoms, or between one to another checkup, there have been some small changes that they don't mention maybe during the communication with the specialist. So this was really important in these needs. And the needs expressed by the neurologist were more to translate the symptoms into measurable signs. So the idea is thanks to this solution to shorten the delay of detection of the progression of the disease. Next slide, please. So as explained, so we first had a need that was in our case expressed by 3 organizations. One, the Department of Neurologists from a hospital here in Cartagena in the south of the region, a patient association of multiple sclerosis, and also university, the Polytechnical University of Cartagena, for the technical part of the need. So what we did in each region is to convert these needs into challenges. So to launch a call for solutions, we translate in a more technical and with requirements specific to in each region. So in our case, the challenge was, as I explained before, to have this sensor application to patient using Internet of Things for the detection of the progression. Next slide, please. Yeah, so this is more or less what Stefan also presented. In our case, the company selected is called Pulso Ediciones, and they are developing the ICT e-health platform. And all of this, now the solution is called MS Progress. Next slide, please. Okay, so the co-creation is based on methodology that we developed under CHERRIES. But in the case of Murcia, we have a monitoring team, a challenge proposer team, that was the 3 organizations I just mentioned, and the solution provider. So the monitoring team is composed by the Servicio Murciano de Salud, as same, because we are the facilitator of the whole process, let's say, the region of Murcia with the General Director of European Union, and TIC Biomed with health clusters. So next slide, please. I won't go into detail of each partner organization, but you can have a look afterwards if you want. Please, can you? Yeah, thank you. So how we work. First of all, we sign a subgrant agreement between the facilitator. This is for the whole process. It's the same in each region, between the facilitator, territorial facilitator, and the solution provider. And then we constitute, at the same time, in parallel, the co-creation team that will develop the co-creation plan. So now, in our case, the pilot is running since June. So we co-design and co-create some prototypes. The solution provider is involved in the whole process, of course, but is taking account of all the requirements, the comments that bring the professional of the healthcare sector, and also the patients and the researcher that are working on the challenge. And then, so the pilot implementation had started in October, November with 30 patients, and it was foreseen to last for 5 months, together with some monitoring actions to adjust the solution in views of validate a solution at the end of the process that could be integrated in the healthcare sector, and all the process is monitored. So we have regular checkpoints. Yeah. So what is our solution? We have a patient that is wearing a Fitbit, a smartwatch, that is sending some data to a mobile phone, and these data are sent to a data server, and all of this, the solution provider has developed an algorithm that is interpreting, let's say, the data to send them back to the platform, web platform, to be accessible for the healthcare sector. So in this algorithm, it leads to some interpretation of the data, and it's a movement of the wrist basically, but we have also some other data registering to have a good overview of the progression of the disease. Next slide, please. So yes, so as I mentioned before, we started in June, but the prototypes, the launching of the final prototype was in September. As you see, we have a first one, a second one, and the final one. And in all this process, I would insist on that. We had regular meetings of co-creation, just to incorporate all the feedback from the professional and the patient, in terms also in user experience, and to integrate how the user can also agree on the type of device we're using, and that the whole solution is feasible for all the stakeholders. Next slide, please. Yes, so in November, we had to suspend the pilot for 1 month due to some technical issues that in real life setting can happen. It's innovation. So, and now we are starting again the prototype deployment. And so the end of pilot is foreseen in June 22. So, and I think it's the last slide. So thank you very much for your attention. If you have any question, I will be happy to answer them. Thank you.
Thank you very much, Laura, for the presentation. This is what has been implemented in Murcia. The complexity comes from the fact that a lot of different stakeholders are involved in the process. So it is not only the hospital, but also the patient association, let's say the technological, or the universities and the professionals, and that it is the main challenge, to be able to co-create. We are talking about co-creation. To be able to co-create with so many different stakeholders, all of them with different expectations. So you will know a little bit more about how we have been doing this when we'll focus on the different phases of the implementation of CHERRIES. But I think it's a nice example, and I would like to also stress what Laura has said, that this is innovation. It is co-creation, so it doesn't mean that you are going to succeed, let's say, but expectations have to be clear, processes have to be clear, and if we don't succeed for any reason, we just need to explain or find why we were not successful. Okay, so thank you very much, Laura. And now I give the floor to Lene. From Örebro. It is the third pilot region. The process that they have followed, it is different, but I think it's quite interesting also to understand how the co-creation has been set in Örebro in Sweden. So the floor is yours.
Thank you very much, Miriam. Hello, everyone. My name is Lena, and I'm representing the Örebro region. I work at the Regional Development Department, in particular with the public health issues there. Next slide, please. Within the CHERRIES project in the Örebro region, we have two main actors, which is the region where I work, And also we have Activa Foundation, and we have a number of other important actors also that I want to maybe just show a little bit. We have a lot of CSOs. Why this is, I will explain a bit later. We also have the municipalities of Degerfors, Karlskoga and Laxå. We have a partnership for social innovations in Örebro that is a very important actor in this project, and also the University of Örebro that we have also a lot of contact with. Next slide, please. Before I go into how we have organized the CHERRIES project and the pilot in Örebro, I would like to just give a short contextual description of why we have organized things the way we have. And first, I want to talk a little bit about the healthcare system in Sweden. We have a large proportion of public healthcare actors in Sweden. We have an increasing proportion of private, but also publicly funded healthcare actors, but not in Örebro region. This is in Sweden as a total. In Örebro region, we only have public healthcare actors. We have the primary care, which is a shared responsibility between the municipalities in Sweden and the regions, and where the regions are also responsible for the inpatient care. So we have different actors that we need to involve in these kind of projects that regard this healthcare. We also have a huge transformation right now of the healthcare system in Sweden to something that we call person-centered and integrated care. Here we have the primary care as the hub for this change, and the aim is to focus more on the patient, more on promotive and proactive care, and also to see the patient as an active co-creator in their own healthcare. And we see that the CHERRIES project is in the right time for this. We see that the project is helping us with this transformation. Next slide, please. We also have a very strong civil society in Sweden. We have a lot of community service today, which we are taking for granted now, but that originally was civil society based. So civil society is traditionally very strong in Sweden, but we also see that we have a lack of cooperation between public and civilian sector, which is a challenge for us. We also know that the demographic change in particular is an incentive to develop more cross-sectoral collaboration with the civil society, and also regarding social innovations. Next slide. Social innovation, I'm not going to read this whole definition, but social innovation, in case this is not a very familiar concept, is about addressing societal needs in new ways. It can be a lot of different solutions. It can be services, methods, working methods, but the aim is societal benefit and to contribute to an inclusive society. So this is also one of our very strong aims in Örebro, to focus on social innovation. Next slide, please. The region of Örebro, we have 12 municipalities in the region. Within CHERRIES, 3 of those municipalities is mainly involved. We have the Karlskoga municipality with the population right above 30,000 people. We have Degerfors with a population above 9,000 and Laxå with the population over 5,000. So it's 3 rather small municipalities. In Sweden and specifically also within these 3 municipalities, we have a large number of elderly people, which is also a challenge that we share with most of Europe, I believe. But this is something that we have been also focusing on in the CHERRIES project, because we see that this is a challenge for the healthcare that we need to help them address and find more innovative solutions to. We see that these people often, especially people that are lonely, elderly people that are lonely, they are quite a big burden sometimes for the healthcare. And also, of course, we want to find ways to make their lives better. Next slide, please. So the identified need in Örebro region is breaking and preventing loneliness. As I said, we see that loneliness is a huge challenge and a huge problem within this group of the population. We know that long-term loneliness can result in self-isolation, and we also know that there are expectations that other people will make contact. It's hard for many people to reach out by themselves. And we also know that the people with the greatest needs for social contacts can be very difficult to reach with the various efforts that we already do today. So we need to find new ways to address this. Yes, next slide, please. So our open call for solutions was aiming this breaking and preventing involuntary loneliness among elderly. Yes, next slide. So our pilot, the chosen pilot, is called Seniors Leading Seniors to a More Meaningful and Healthier Everyday Life in Laxå Municipality. It's a social innovation which is focusing on new services and new working models in cooperation with, between public and civilian actors. And Laxå municipality is the owner of the solution. Next slide. The pilot project is focusing, as I said, on collaboration. It's a 2-part solution, where the first part is to develop an outreach program that would identify and reach out to the target group using also the collaborating organizations and their existing networks in the area, in the municipality. And the second part will initiate an arena where the target group can meet, and where we can also have a number of activities for the target group, which is also based on co-creation with the target group. So that's the solution. We have a number of collaborating organizations within this project. As I said, Laxå municipality is the coordinator, the owner of the solution. We also have the health center. We have the public health team of this part of the region. We have a number of NGOs or civil society organizations. This is just a few of them. We have a large number of organizations within this project, actually more joining, not every day, but more are joining still within the project. We also have the church and organizations that can speak for the target groups, the elderly organizations. Yes, and next slide, please. So the co-creation looks like this. This plan has been slightly changed because of the COVID situation. But we have during the fall, they developed an outreach program, which is being tested right now. The development of the easy access arena is also ongoing, but some of these activities has been postponed due to COVID, but still being planned to be carried out within the project's time. And in April, we hope to have some results from this project. Thank you very much. I'm also happy to answer any additional questions.
Okay. Thank you very much, Lina. As you can see, the experience that have been or is being tested in Örebro in Sweden is slightly different. It is more focused on civil society and the existing organizations, and but the aim at the end, it is the same. They have identified the need and they found out that the best way to address that need was with this process. And the final thing is start the co-creation process to develop a solution or like a process or different ways of doing things that will match the need identified. So I think that it would be interesting to open a question session right now for all the mirror regions that have been selected. So if you have any question on the 3 pilots that are being implemented in CHERRIES, please feel free to raise your hand. I think it would be the easiest thing if you can raise your hand, and we will give you the word. No? Okay. Sorry. Haven't you got, yeah, Teresa?
Hi, good morning. Just a small question. Would it be possible to have an idea of the length of the development also? I mean, how long did it take to reach this phase in these pilots, and what kind of budget are we talking about for the development? I guess not all took the same time and costed the same, but just some rough numbers. Thank you.
Yeah, so if you can, Laura, Moises, and Lina, go back to just to say which was the length of the whole process of the need identification. We are going to provide all this information to you, but just to sum up, if you can just summarize and say how long did every phase took, and which is the length expected for the co-creation phase that has not been completed yet.
Okay, so shall I start?
Yeah, go on, Moises.
Well, okay, we had the plan and we adjusted the plan mainly because of we had the call for needs, the call for solutions, and then the pilot. In our region, the call for needs was extended from 1 month to 1.5 months, mainly because the demand-driven approach was quite new. So we needed to educate, let's say, the people, because they start asking questions. Why do I have to submit a need and then the need has to be translated into a call for solutions? If I don't have a direct benefit from the need, it's a waste of time for me. So you needed to explain the concept of demand-driven approach. So it was approximately 2 months, the call for need, especially during the COVID situation. It was last year in Christmas. It was November and December 2020. And then once we identified the need, we launched a call for solutions according to the project regulations and the cascade funding. rules, the call for solutions had to be open for 2 months. The amount was 50,000 euros for all the regions. After the 2 months, we spent 1 month evaluating the applications, because we had also, in our approach, we had to set the gender equality also, for example, in the selection process. We had to include other responsible research parameters, such as the specialities of the people involved in the selection process, the technical ones, the theoretical ones, the stakeholders part. So we needed to have patient associations, healthcare professionals, healthcare providers, and policymakers. So this process, because we have received in this particular occasion 13 applications, not all of them were from Cyprus. 30% of them was from Europe, from the rest of Europe. It was 1 month of the selection process, and currently we are. It was predefined that the pilot has a duration of 10 months, and currently we are in the middle of the pilot, month 5 in Cyprus. We spent 1 month in back and forth exchange of negotiation with the legal documents and the IP with the solution provider. In other regions, it follows more or less the same structure, but different timelines. Thank you.
I would just like to also try to answer this question really briefly and give the aggregate of the regions, so to say. So, like, I think the call for needs, the solution, this identification process was open in fall 2020. Until then, we were in the preparation phase. It was open 1 to 2 months, depending on the regions. We were not completely in sync. Then there was a selection process, the transformation into this Open Innovation Challenge that was then launched around the end of 2020, beginning of 2021. As Moises already explained, it needed to be open for 2 months according to EC regulation. Then around 1 to 2 months for selection and contractual issues, and then there is a 10-month co-creation phase foreseen. The maximum budget each region had was 50,000 euros. As one could expect, many applicants went for the maximum, but in Sweden, there was actually the case that the solution provider was only requesting a small amount, because they said, for our idea, we don't need the 50,000 euros. That's also why in Sweden, they were going for a second round and say, okay, we are selecting a second solution provider. And we launched this call again with the rest of the money. Yeah, and we're in the middle of this co-creation phase in month 5, around-ish, because we're not completely in sync. And I think that is the rough numbers.
Laura and Lena, thank you very much, Stefan. Laura and Lena, if you want to add anything here.
Well, I think, yeah, the process in our case is also because we are developing also the methodology. So I think it has to be underlined that once the methodology is clear, then it's the process might be shortened. But yes, in each stage, what requires a lot of time and involvement is a stakeholder engagement. Because as Moises said, we try to have this RRI approach in every step of the process. So meaning in all the juries, all the selection committees, it has to be gender balanced. We try to, but also inclusive. So not only having some IT experts and healthcare professionals, but also it's in the free region some association, but also in our case the research, etc. And it takes time to have the people engaged, involved, and so this is clear. But all the process is also very, I would say, very even if it's time consuming, it's very interesting because we learn on the regional ecosystem, let's say, but also in our own practice and how we can improve them toward this co-creation and highly participative method. So, but I guess we will see all of this later on. But yeah, the timeline is from the call for needs, what started in fall 2020 to the selection of the solution provider. It has been almost 8 months, I would say. And then you have the implementation of the co-creation. That in our case will be 2 months delayed for the technical issue we had.
Mm-hmm. Yeah, I mean, I think, well, it's not, I think I know that we are going to provide concrete details in the next workshops that are going to be focused on concrete phases. So on the phase 1, the need identification, the second phase on how to launch the call and make the evaluation, and the third phase, that is the co-creation. But there are obviously some issues that will condition the length of the process. As Moises said, if this is the very first time that you are working from the demand approach, from a demand-driven approach, it might take a little bit longer just to explain all the stakeholders what we want to do, how we are going to do that, and as I said at the very beginning, to set clear expectations on what could be expected as a result. And that takes a little bit of time to understand a new process to be introduced in the region. The other point is this stakeholder engagement. It takes a little bit of time just to put everyone working together, because we are not usually ready to work with in co-creations. We try to work in silos, or we tend to work in silos. So making this stakeholder engagement, not only the process, but also what is beneficial from them, it takes a little bit. And then regarding the question of budget, for Cherries, we started with, or we set a budget on 50,000 euros. Then, for example, as Stefan said, in Örebro, the budget was really high, so 2 calls were launched. My suggestion for all the mirror regions is to identify which is the need, or it's either way. If you haven't got any limitation in budget, just identify which is the need and make a measure that is like, which is the budget that you should need. If you have limitations in the budget, that it is usually what happens. It's like if you only have, I don't know, 50,000 euros, when selecting the need, select those needs that are fully aligned with that budget, like that are going to be able to be implemented with that budget, and not the other way around. So it's like the budget available really conditioned somehow which are the needs that everyone's going to be working in. Okay. We are a little behind schedule, so I suggest that we can move now into the presentations from the mirror regions. Well, I didn't say that at the very beginning, but congratulations, and I hope that this is going to be an interesting experience for you to learn how to implement this demand-driven approach, taking in consideration the RRI and the stakeholders' engagements. It's like how to work together in a region towards the best results, and just to make it better at the regional level. So as I see that we will start with Burgos in Spain. So Javier, the floor is yours. Javier, maybe you are muted.
Hello?
Yeah, hello.
Hello, I'm on the air now. Okay. Good morning to all of you. My name is Javier Sardiñas, and I'm trying to explain that's why Burgos province it's a mirror region for this important project. Okay. Burgos is a province of Spain belonging to the autonomous community of Castilla y León. Castilla y León, in fact, is probably one of the most extended area in Spain, and Burgos province is located in the north of the Iberian Peninsula. It's halfway between Madrid and Bilbao. Burgos is the Spanish province with 371 municipalities, more than 1,200 population centers. It had almost 400,000 inhabitants, and the density of the province is 25 inhabitants per square kilometers, lower than the 95 inhabitants per square kilometer of Spain. That's why we are a part of the empty Spain. That's why we are in the rural areas in the north of Spain. Okay, in the province of Burgos, the 24% of population it's 65 years older. So that's why we have problems with low demographic dynamics. We have problems with the natality, and we have problems because we have a low birth rate in the Burgos province. But in the other part, Burgos has an industrial character and dynamic and competitive economy and highly diversified industry of Castilla y León. And Burgos province ranks as the third most populated in Castilla y León. That's why we have problems with the older people, and we have problems with natality and low demographic. And so the next slide, please. Okay, and the consortium members that we are working in this project, it belongs to the Big Burgos. I'm working for the Big Burgos, the Business Innovation Center of Burgos, and my partner Cristina works with Sodebur. Sodebur, in fact, is the Society for the Development of Province of Burgos, and is an instrumental entity of the Provincial Council to promote the economy and social development of our province and its municipalities. To do this, Sodebur develops its structural work in 5 areas: energy, industry, tourism, institutional cooperation and economy, and social promotion. Sodebur as an instrumental entity of the government of the province, and one of the main tasks of Sodebur is the preparation, execution, and monitoring of the strategic plan for the development of the provincial of Burgos in all its planes. And okay, next slide, please. And in relative to the commitment challenges in our region, we have identified main problems. We consider would be related to housing in rural areas. And the first problem is a fast and sustainable construction solution for the rehabilitation of rural housing. And the second problem, it could be the financial solution for the rehabilitation of rural housing. The issue of rural housing in a province like Burgos is really important, because although a priority, there will be many houses in all localities, and it has been detected that there are no housing available to move into, and therefore the demographic challenges are affected. So the accommodation is relevant as an important factor to fight the population and address the so-called demographic challenge in empty Spain. And the commitment, we think, and we considering the possibility of formally implementation and open innovation dynamic to address certain problems that affect the economy and social development of the province, So the new about the existence of the CHERRIES project and its methodological development is very interesting at this time. In the 3 or 4 years, we have been working of open innovation approaches and dynamic for years to increase the added value and innovation of local entrepreneurship, as well as to facilitate and accelerate the innovation of SMEs, organization, and public administration. We have two examples with the City Council of Burgos and another initiative with the Open Future of Telefónica. It's the mainly company of communication in Spain. And for my part, that's all. Thank you for your attention.
Thank you very much, Javier, for your presentation. Not to put any pressure, but you are the only region that was selected that is not focused on healthcare. So it is going to be challenging just to, and it's quite important for CHERRIES just to make sure that we are able to transfer the methodology to a sector that is not the healthcare. So I'm very much looking forward to working with you.
Okay, the same to you, to all of you.
Okay, so the next region presenting and the next mirror region is Coimbra. So I leave the floor to Antonio.
Hello, good morning to everyone. It's a pleasure to meet you. Yes, I will present our initiative, the Aging at Coimbra, that is referenced in healthy aging. Active and healthy aging. The coordinator, Professor Romava, apologized but cannot be present in this meeting. Already had another appointment. But anyway, I will share you some information about our ecosystem. Please, next slide. This is our ambition. We exist somehow to increase the probability to live longer with health. I think it's our common ambition, right? But we need to have, or need to work into different variables, the prevention and intervention. We know that if we do a good job, if we perform a good job in prevention, somehow we reduce probability to have like a hard intervention. Next slide, please. But what we know also is that the reality, it's not perfect, right? We have a lot of needs in this intervention and prevention, a lot of needs from the society, from the citizen, from the caregivers and so. And in the left side, we know also that we have a lot of R&D potential, a lot of capacity in universities and technological centers. But we know, and I believe that you know also, that we have a gap. Right, so it's very hard to match both expectations, both realities. And next slide, please. And that's why we engaging at Coimbra, we try to mix or we try to produce innovation based on knowledge and research, transform some knowledge and research in innovation. Next slide, please. Then the main aim of our partnership is to put the critical institutions or persons at the same table once a month. Is to understand that our ecosystem or our innovation chain, it's not magic. We have partners and we need to align these dots. Putting at the same table the social care, the environment, for example, the city council. The knowledge, of course, the University of Coimbra is a central figure, has a source of knowledge here. The university hospital and also the capacity to transform this knowledge in innovation. It's for example, our case in IPN that I will explain you later. The reality is similar with other regions, but maybe a little bit harder. We have more or less 20% of older adults plus 65. Next slide, please. We have two types of partners. We have the core partners, founders or not. The Coimbra University, the City Council, the University Hospital, the Health Authority, our Institute Pernuns, that is RTO, the regional authorities, CCDRC, the nursing school, the Caritas, Diocesana de Coimbra, and also the social security, the central part of social security. And also to complete this partnership, we have plus than 80 members. That it's a quite large partnership in our region. Please, next slide. We work in different areas in polymedication, frailty, cognitive decline, integrated care. Integrated care, it's a quite important topic in our region. And please move on. But what we know also is that we cannot collaborate if we don't have, and sorry for the word, if we don't put money on that, right? That's why the Aging at Coimbra has this or performed this effort to attract resources to assure that we can collaborate. And also we have the efforts to balance the efforts. We know that we need to have some efforts more in the fundamental research, but also to have initiatives or projects that could generate an impact in a short term in society and in the companies. That's why you have these different levels. We have, for example, AirShare or Maya, that are initiatives more related with fundamental research, top level. And we have, for example, the collaborative lab that is closer to the society, and also some projects more with a short-term impact. Then somehow the key issue here is to have a complete chain between fundamental and also applied research. Please, next slide. I will give you some examples about these initiatives that we are performing at regional level. This is AirShare. It's a very important program in fundamental research. Please, next slide. Maya is one of the most relevant initiatives related with aging research in south of Europe. Next slide, please. We have also a PhD school financed by the EITL initiative. Next slide, please. But we have also some initiatives that could generate a direct impact in the citizen, and this is a project that somehow is a proof that the science could generate a immediate impact in the citizen. Please move on. We developed a lifestyle assessment toolkit, and we did two initiatives. One in a shopping mall where the citizens could go and perform this lifestyle assessment. And after 15 or 20 minutes, we received 3 sheets of paper with specific information how he or she could improve the lifestyle. And behind of this is a questionnaire produced by the medicine faculty, and also with our support, the IPN support in other organizations, to perform these some of these questionnaires or toolkit. Then we did 2 initiatives. One in a shopping mall where we invited people to assist and to use this toolkit, but we had a second edition. Then instead to ask for people to join us, we joined the people, and we packed all the things in a van and went to a very small villages in central region, and it was a novelty for these people, because normally people are not expecting to see this type of initiatives, that someone asks if they are healthy or not, and how help them to contribute to have a healthy lifestyle. Please, next slide. You can move on. There are examples that somehow it's a concern also to have impact in society. Okay, this is another initiative, and we consider that also very relevant because it's a service that our central hospital has dedicated to aging population. Like instead to have only a general emergency service, they have a specific service to receive aging population, and it's very important to somehow to set up all the things to receive the people or with these special characteristics. Please, next slide. We have more focused projects, more technology-based projects involving some startups, and so this is a robotic system to do ultrasound examinations remotely, for example. Please, next slide. And we have other initiatives that they are also important. I will explain you a little bit why.
But Antonio,
yes.
sorry, this is Miriam. I think we are running a little bit out of time. So if you, I mean, we will make it possible for you to further explain to the other mirror regions what Coimbra is doing. But right in this meeting, I think that we go in detail on all your experiences. We are going to really run out of time. So if you can just go over the experiences.
Understood. I will.
I'm really sorry.
Finalize. Okay, no problem. This is an award that the regional authority organized to classify the best practices in aging, and it's important for two reasons. Of course, to show who is doing better, but also to map the ecosystem. That's why I'm referring this as a good practice. Please move on. You can jump in then in next slides because it's, you know, that it's important to live only at regional level. We have we have a strong connection. Please stop there. We have connection with two very important hubs, the EIT Health and also European Innovation Partnership on Active and Healthy Aging. And the previous slide said that we are aligned also with the smart specialization strategy in specifically with platform 3, mobilization of technologies for quality of life. And of course, it's important to finance the initiatives in the next years. And finally, next slide, please. We have some information about the region, the capacity that we have in the central region. That if I don't have time, please, if you are curious, you can see later. And yes, that's it.
I mean, thank you very much, Antonio, because I know that Coimbra has got wide experience into active and healthy aging, and the work that you are doing with reference sites, yeah, I think is a reference for all European regions. What I'm thinking is, as I said, as we can organize different workshops where one mirror region is taking the lead, just presenting their experiences. And I know that it's going to be of a lot of interest, not only for the CHERRIES regions, but also from some of the regions that would like to be working on this arena. So thank you very much, and apologies for shortening your presentation. Okay. So now we move into the third mirror region, Northeast Romania. So I leave you the floor.
Thank you very much, Miriam. Very happy to be on board on CHERRIES family. And I would like to shortly present my region and our experience. Next slide. Northeast region is the largest developed region from Romania in terms of population and area. We are around 4 million people, and the area is approximately 47,000 square kilometers. Northeast region stakeholders are determined to create and transfer and implement innovation in a systemic manner, and we have identified a potential area for specialization, and I will present it a little bit shorter. In the next slide, I would like to locate a little bit my region. We are on the cross border of European Union, and the next slide will present this location. We are composed of 6 counties, and we are covering the northeast part of Romania, and we have a cross border with Ukraine and Republic of Moldavia. Within the next slide, I would like to present the regional innovation ecosystem. The fact that health is a middle of our innovation ecosystem. We do have also agri-food and wood industry, energy, tourism, environment, ICT, and textiles. Within the following slide, I would like to present to you the health niches and sub-niches that we intend to replicate the CHERRIES model. We are active in preventive medicine, precision medicine, e-health, especially biosafety, medical and pharmaceutical biotechnologies. And shortly, I have presented the number of medical units, hospital beds, and doctors in order to have a short overview of healthcare statistics that we have in our region. Within the next slide, I would like to present the partner that have submitted application for CHERRIES region. I'm representing Northeast Regional Development Agency. We are a non-government and non-profit organization, and we are contributed to the economic and social development of our region. And within the next period, there will be a managing authority for the regional operation program, and we intend to realize this model of co-creation in order to prepare the guidelines for the future calls that will be part of the regional operation program during the next period of programming, 2021-2027. And our goal is to create a smart, sustainable, inclusive region in order to increase the quality of life and to reduction of the intra and inter-regional development gaps. Our main stakeholder within the region dedicated to healthcare is Northeast Regional Innovative Cluster for Structural and Molecular Imaging. Northeast RDA is the founding member of Imago Mall Cluster. It's active from 2012. We have 10 years of experience in healthcare projects. It's the only medical imaging cluster in Romania and in European Union. We are dedicated to the growth of scientific competitiveness of our members and to increase the economic competitiveness of our region in the field of medical imaging. But we have dedicated a lot of projects to digital health and e-health lately. Mental health, we have enlarged our scope in order to address the healthcare challenges that are important in these days. The cluster gathers 50 members from all the areas of quadruple helix. We have healthcare providers, SMEs, education and research organization, and associations that are representing patients, public authorities, and facilitators. In order to have a perfect healthcare provider that can help us to replicate CHERRIES model, we have invited Providența Hospital and Polyclinic, which is a healthcare organization based in Iași. It's an academic and medical center that treats over 20,000 patients yearly in its hospital and polyclinic. This clinic has also a research center dedicated to patients and to the integrative medical healthcare, and has a holistic approach of patients' healthcare. It was more dynamic, and we think that it's perfectly fitted for the co-creation part of a CHERRIES model. Within the following slide, we addressing aspect by the innovative sector that we want to replicate the CHERRIES model is healthcare, as mentioned, and we are committed to apply the CHERRIES methodology in order to use more efficiently the structural funds and to foster innovation in the area of digital healthcare transformation and personalized medicine. We are interested in the need identification in the area of digital healthcare transformation and personalized medicine. We are interested to learn how to design call for solution in order to foster the regional innovation among the regional healthcare stakeholders presented by Imago Mall Cluster. And we are eager to facilitate the co-creation process in order to use more efficiently the regional structural funds that Northeast RDA is managing in the next programming period. We're only hoping that we will create the synergies to CHERRIES model and will ensure a good replication of CHERRIES model within our region. I hope that my short presentation has somehow succeeded to fit the agenda, Miriam. And
no, thank you very much, Alina. Well, I mean, this is the kickoff. This is just like the first attempt for everyone to know what the others are doing. But of course, we will have enough time in the coming year in 2022 to dig deeper on the different characteristics and the framework conditions of every region. So yeah, thank you.
We do have a various portfolio of projects of good practices, but I think that I have not presented here because it was just a short overview, and I have not individually presented all the project that we are dealing with.
Yeah, and I know it's quite a few of them, so it will take much longer. Thank you very much, Alina. And now we move into the fourth mirror region, west of Ireland. So I leave you the floor to present the main features of west of Ireland.
Thank you. Can you hear me okay?
Mm-hmm.
Yeah,
yes, perfect.
Yeah, so my name is Alina Dean. I'm from the Western Development Commission in the west of Ireland, and I look after regional enterprise development in a subset of counties. Can I go to the next slide, please? So the west of Ireland is, as the name suggests, at the west part of the island of Ireland. And it's a region that suffers from what also others have described of a dispersed population that is predominantly rural, while at the same time also having some good development in technology, innovation, and industry. Predominantly, we have micro enterprises and SMEs in our region, and as said, also the economic activities quite dispersed. In addition to this, as you can see on the map, off the coast of the West Ireland, we also have a number of island communities, and we are looking to address the challenges on how to service not only the periphery and rural areas on the mainland, but also islands who have specific connectivity and service delivery challenges. Do you mind going to the next slide, please? So our core consortium members are the Western Development Commission. The Western Development Commission is a regional agency that has a policy function, but is also looking to act as a catalyst for regional innovation. We are cooperating with Cisco, who is a key technological enabler for this proposed pilot, and is very well versed in a lot of types of digital infrastructure and systems. Also important part of our collaboration is with the Health Service Executives Digital Transformation Group. The Health Service Executive is actually the publicly funded healthcare system in the Republic of Ireland, and who are responsible for provision of health and personal social services, and have also obviously great interest in piloting new approaches in delivering of remote healthcare. And National University of Ireland, Galway is the only city in the region that you have seen on the map, and this is one of our key universities in the country, who are also part of EIT Health, which was mentioned before, but also participates in the Health Innovation Hub Ireland, which helps bring new innovations in healthcare to the market. In addition to these co-partners, we will also collaborate with the community on the Clare Island is our pilot island, and supported by the local municipality, SMEs and other partners. Next slide, please. I'm keeping this very short because I'm conscious of time. So the focus of our proposed pilot would be rural remote healthcare. And as I mentioned, the specific challenge of delivering healthcare to islands which have low transport connectivity with the mainland, sporadic access to services and so on. So this is a pilot that would be incorporated under the most difficult circumstances, if you like, and we hope this would provide a blueprint for replication then under less onerous circumstances as well. This is part of an overall strategy as well of having an Atlantic innovation region where we maximize the potential of what is, as I said, a rural and dispersed set of counties, and utilizing the methodology of the living lab and producing something that's hopefully modular and readily scalable. So that is our goal. So sorry for keeping it very short, because I know we're running out of time. I hope that's okay.
Thank you very much, Elena. As I said, after realizing that maybe some additional time it is needed for you to present each of your regions, we will devote and we will organize like a concrete workshops for you to dig deeper into what you have just presented. But I think your presentations, the four of them, gives a good idea on your framework conditions, what you aim to achieve with CHERRIES, and I think that by working together with the CHERRIES pilot regions, we will manage to establish all the methodologies and to start co-creation process in all the mirror regions. Okay, so the way we have paired the CHERRIES region and the mirror regions follow or take into consideration similar profiles or similar needs. And now Ulises is going to present which is the content of the activities that are included into this mirror region process and the CHERRIES community. So Ulises, the floor is yours.
Okay, thank you. Well, hello everyone. I'm going to present you the 14 activities for the mirror regions. First of all, thank you for being here. I'm very glad to have you here because it's been a very challenging process, and I would like to congratulate you because you have passed, like, you are top of the class among the applications that we have received. As I know that we are really over the schedule and we're running out of time, I'm going to try to do it as fast as possible. I'm going to explain you the next activities that you will take. Those are the training workshops that will be starting next week, the one-on-one coaching sessions, then the 2 face-to-face events, the one in Brussels in May, and the last one for the final session in the European Week of Regions and Cities. Well, as you know, the CHERRIES methodology is divided into 3 different activities, so to say. So we are planning 3 different workshops for each one of those activities. The first one is starting next week on Thursday or Friday, I think, and it will be devoted to the need identification. 2 colleagues from the CHERRIES consortium will give this workshop. And then in February, we will have the number 2, the call for solutions, and in March, the last one, the one dedicated to the creation process. Those workshops are aimed at providing capacitation and know-how transfer for the 3 stages of the methodology. Will be interactive sessions, which means that you can talk and you can raise your hand and ask any questions that you have on your mind. And will be attended, or can be attended by all the consortium members. I'm seeing this because I have received some questions from some of you asking if you can attend all these workshops. You are totally free to attend them. And also, we will record those sessions and we will share this after. So don't worry if you cannot make it for the day, because we will share later the recordings. Well, as Miriam was mentioning, we have divided the different mirror regions in different groups, and we have paired them with the pilot regions. We have done this under the perspective of different things that we consider that really match the other region. For example, in the case of Coimbra and Örebro, the treatment of aging people and loneliness, and the same applies for the other regions. For the case of Burgos, we have decided that we are going to give them the support because they were developing a different sector, and it really didn't match with anything else. So that's why it has like a different treatment. Regarding the one-on-one sessions, they will be starting next month in February. Will be held on a monthly basis, which means that every month you will meet with your paid region to discuss how the process of the methodology is going on. You will have also the possibility to ask for a particular meeting. If you want to have an extra meeting, you are totally free to do it. And we will share different contact details information, so the pilot regions will contact you to schedule the meetings. As I was saying, those meetings are aimed at solving issues that will come up during the implementation, and will be based totally on the particular questions you will have during the application of the methodology. Then you will have a face-to-face session that will take place, if the COVID allows us, in Brussels on the 25th of May during the EBN Congress. You can send up to 3 representatives per each main region that will be paid by the CHERRIES project because it's in the budget, and will be based on the pilot regions implementation. That you will have another session to validate the initial sustainability options, and you can share what has been going on until that moment. The idea of this event is more to give you the opportunity to get to know each other and to have a space in which you can create some kind of networking. So it's more like an opportunity for you to create a network of practitioners, anything else. And then you will have a final event that will take place in October, most likely, during the European Week of Regions and Cities. The idea of this project is to address the sustainability of the project. You will have bilateral interviews to dig into specific replication elements. For example, you have some feedback to give us, or if you want to comment something on how it's going to be, how it's going to be for you this mirror regions process. Also, we will share a questionnaire that you will have to fill out for the event, in which we are going to ask you all these questions. And then we will present the final conclusions of the project and of the mirror regions in the event organized in the European Week of Regions and Cities. This is the timeline of activities. As you know, we are now here in the kickoff meeting. The next 3 months will be devoted to these workshops, and the one-on-one meetings will start in February and will finalize in December. Here in May, we have the face-to-face meeting in Brussels, and in October, the final exchange. And that would be all. I don't know if you have any questions. We have so much time that if you have any kind of quick question, feel free to raise your hand and ask something.
The time being, just to summarize, the whole idea is to present the different 3 phases in which the CHERRIES methodology is split. So first of all, the identification of the needs. Secondly, how we launch the calls, and thirdly, how to implement the co-creation process. So on each of these workshops, we will present the CHERRIES experience, but we will also present why it is important to focus on those concrete 3 aspects in the implementation of the methodology. So that is the way to start with. Then we will have these one-on-one coaching sessions with your coaches. And the idea is, again, to put in the table as many questions as you may have when it comes to implement the CHERRIES methodology. Hopefully, and I keep my fingers crossed, we will be able to meet face-to-face. And that will be, I mean, if we manage to do that, that will be great, because that will allow us to set a network and for you to better understand what the others are doing. And then we would like to present at the final event which are your findings, how is your implementation process going, and so let's say enlarge the findings that we may have from CHERRIES to the ones that are provided from the mirror regions. So this is quite an interactive process. It's again co-creation among the CHERRIES regions and the mirror regions, but still we will be more than happy to receive any suggestion or comments that you may have that could make it easier for you to implement the process. Okay. So now I open the floor. If you have any, I know we are a little bit behind schedule, and now our agendas are full of meetings, but if any of you have got any questions, the floor is open. Okay. I hope it is because everything was clear, not because it was unclear. But so I would like to thank you everyone for attending this meeting, both the mirror regions and also the CHERRIES partners. And I'm sure we will set like a really nice co-creation process from now until the end of CHERRIES. So thank you very much, everyone.
Sorry, before leaving, if we can all of us turn on the camera for a picture.
Yeah, sorry, because, I forgot.
Yeah, don't worry.
Bye, everyone. See you soon.
Okay, I've got the ones at least that had the camera on. Thank you very much.
Okay. So thank you. Yeah, thank you so much. And you will receive all the meeting requests for the next workshops. Bye.
Thank you.
Thank you. Bye, John.
Thank you. Bye-bye.